Hello everyone, I'm Rod Matos Jr. and welcome to the channel. If you're new here, I'm glad you've joined us today. On this channel, we dive deep into the strategies and insights that are shaping the future of business, particularly when it comes to managing one of the most significant challenges employers face today, healthcare costs. Now, this is a topic that affects everyone, from the C-suite to the frontline workers. And as we all know, healthcare costs aren't just rising, they're soaring. But don't worry, because today we're going to explore innovation strategies that can help you not only manage these costs, but also enhance the overall well-being of your employees. Let's face it, healthcare costs are a major concern for employers of all sizes. Whether you're running a small business or managing a large corporation, the challenge remains the same. How do you provide comprehensive healthcare coverage without breaking the bank? The old strategies, cutting benefits or passing more costs on to the employees, it just doesn't cut it anymore. They can lead to disengagement, high turnover, and ultimately lower productivity. But there's hope. We're seeing a shift in how employers approach healthcare. It's no longer about quick fixes, but about building sustainable long-term strategies that benefit both the company and its employees. Today, I'm going to walk you through some of the most forward-thinking approaches that are making waves in the industry. Before we get into the strategies themselves, it's crucial to understand the scope of the problem we're dealing with. Over the last decade, the average annual premium for employer-sponsored health insurance has increased by more than 50%. Think about that for a moment. 50%. This rate of increase far outpaces inflation and wage growth, creating a scenario where both businesses and employees are feeling the pinch. Now, why are healthcare costs rising so rapidly? Well, it's not just one factor, but a confluence of issues. We're talking about the increasing cost of prescription drugs, the growing prevalence of chronic diseases like diabetes and heart disease, the aging workforce, and even the rapid advancements in medical technology that, while beneficial, come with a hefty price tag. Add that to the administrative inefficiencies in our healthcare system, bureaucracies that often lead to unnecessary costs, and you have a perfect storm that's driving expenses through the roof. Given this complexity, there's no silver bullet, no single solution that can magically fix the problem. What's needed is a multi-pronged approach that not only tackles the costs head-on, but also ensures that the employees continue to receive the quality care that they need and deserve. So let's dive into some of these innovative strategies, starting with one that's been gaining a lot of traction in recent years: comprehensive wellness programs. Wellness programs are not a new concept, but the way they're being implemented today is far more sophisticated than in the past. The goal here is to move from reactive healthcare, treating issues after they arise, to proactive healthcare, where the focus is on prevention. Imagine a workplace where employees are encouraged to take control of their health, participate in fitness challenges, attend nutrition workshops, and even receive mental health support. Now let's break that down. What makes a wellness program truly effective? First, there's the physical health component. Regular health screenings, fitness challenges, gym membership subsidies, and nutrition education. But that's just the beginning. A truly comprehensive program also addresses mental health, which, as we'll discuss later, is a crucial factor in overall well-being. Stress management workshops, access to mental health professionals, and even initiatives like smoking cessation programs all play a vital role in creating a healthier, more engaged workforce. But does it work? Absolutely. Take the example of Johnson & Johnson, a company that has been a leader in corporate wellness. They've reported a significant savings, about $2.71 for every dollar spent on employee wellness programs. These savings come from reduced healthcare costs, fewer sick days, and higher productivity. So when done right, wellness programs are not just for your employees, they're good for your bottom line. Next up, let's talk about telemedicine, a game changer in the healthcare industry. The rise of telemedicine has opened new doors for delivering healthcare in a cost-effective way. With virtual office visits and remote monitoring, employees can receive care more efficiently, more conveniently, and at a lower cost. This approach is particularly beneficial for managing chronic conditions like diabetes or hypertension, where regular check-ins with healthcare providers are essential. But telemedicine isn't just about convenience. It's about reducing costs in a significant way. For example, telemedicine can also reduce the need for expensive emergency rooms visits, providing immediate access to care for non-emergency issues. It also lowers transportation costs for patients who might otherwise have to take time off work to travel to appointments. And let's not forget the impact on productivity. So when employees can consult with their doctors from the comfort of their desks, from their homes, they're less likely to miss work, which translates into higher productivity. Another exciting aspect of telemedicine is its potential to increase access to specialists, especially in the rural areas where healthcare options are most often limited. Some companies are even setting up on-site telemedicine stations, making it easier for employees to access care during their workday. This not only supports employee health, but also fosters a culture of well-being in the workplace. Now let's shift gear and talk about value-based care models, a relatively new approach that's turning the traditional fee-for-service model on its head. Instead of paying healthcare providers based on the number of services they deliver, value-based care ties payments to the quality of care you provide. This shift encourages healthcare providers to focus on efficiency and better patient outcomes, which ultimately helps reduce costs for employers. What does this look like in practice? Value-based care often involves bundled payments for episodes of care, meaning that providers receive a single payment for all services related to treatment or condition. This approach incentivizes providers to deliver high-quality care without unnecessary tests or procedures. We're also seeing the rise of accountable care organizations, also known as ACOs, and also patient-centered medical homes, both of which aim to provide coordinated, comprehensive care that improves patient outcomes. For employers, partnering with providers who have adopted value-based care models can lead to significant cost savings while ensuring that employees receive the best possible care. It's a win-win situation where healthier employees lead to lower healthcare costs and higher productivity. In today's data-driven world, advanced analytics are changing how employers manage healthcare costs. By analyzing claims data, health assessments, and other critical information, companies can identify high-risk employees and implement targeted interventions that prevent costly health events. Let's dive a little deeper into this. Predictive modeling, for instance, allows employers to identify employees who are at risk for chronic conditions like diabetes or heart disease. Once these employees are identified, personalized health coaching programs can be implemented to help them manage their conditions before they become more serious and costly. But it's not just about preventing chronic conditions. Data analytics can also be used to design better benefit packages by analyzing healthcare utilization patterns. For example, if data shows that a significant portion of your workforce is using urgent care services, you might consider offering a telemedicine option that provides the same level of care at a lower cost. The key takeaway here is that data-driven strategies allow employers to use their healthcare resources more efficiently, focusing on the areas that will have the most significant impact on both the employee and cost reduction. When it comes to funding healthcare, traditional fully insured plans aren't the only option. Many employers are now exploring alternative funding models that offer flexibility and potential cost savings. Let's take a closer look at three of the most popular options: self-funding, level funding, and reference-based pricing. Self-funding, which may include partial self-funding or full self-funded, involves employers taking on a portion of the financial risk of their employees' healthcare claims. While this might sound risky, it often results in lower administrative costs and gives employees more control over the design of their health plans. For companies with a healthy workforce, self-funding can lead to significant savings. A component of self-funding is an opportunity to implement direct contracting. Most clients trying to control rising healthcare insurance costs transition from traditional fully insured plans to partially self-funded and even fully self-funded plans. This allows for customization and incentive cost control. There are three ways to approach direct contracting. One is direct negotiation, so picking up the phone and negotiating directly with the hospitals or physician groups for either system-wide contracts or single case agreements. The second is using aggregators. These are high-performance networks that have negotiated preferred pricing in major metro markets. Employers can join these networks via a joinder agreement, easily giving employees access to better pricing. The third is care bundles. Vendors have negotiated care bundles for specific types of care, such as musculoskeletal or general surgeries. These are discounted based on volume and are easy to implement. Level funding combines elements of both fully insured and self-funded plans. It offers predictable monthly payments, but with a twist. Employers may receive a refund if the total claims are lower than the expected. This model provides the best of both worlds, financially predictable and the potential for savings. Reference-based pricing is an innovative model where a fixed amount is set for specific services. This amount is typically based on a percentage of Medicare rates or another benchmark. Employers who use this model can control costs by setting clear limits on what they're willing to pay for certain procedures while still providing quality care. While these alternative models can offer substantial savings, they also come with complexities and risks. It's essential for employers to carefully evaluate their options and seek guidance from experienced advisors to ensure they're making the best choice for their organization. Empowering employees to become informed healthcare consumers is another critical strategy for reducing costs. When employees understand their healthcare options and the associated costs, they're more likely to make decisions that are both cost-effective and beneficial to their health. So how do you promote healthcare consumerism in your organization? Start by providing price transparency tools that allow employees to compare the costs of different procedures and medications. For example, if an employee needs an MRI, they can use these tools to find the most affordable option without compromising on quality. Another effective approach is to offer decision-supported resources. For instance, helping them understand when it's appropriate to visit an urgent care center or versus the emergency room can lead to significant cost savings. Health savings accounts, HSAs, and other consumer-directed health plans are also powerful tools in promoting healthcare consumerism. These accounts encourage employees to spend their healthcare dollars wisely, knowing that any unused funds roll over year to year. This helps build a nest egg for future healthcare needs. Finally, education is key. Offer workshops or online resources that teach employees how to read medical bills and spot errors. This not only empowers them to take control of their healthcare spending, but also helps reduce unnecessary costs for the company. Last but certainly not least, let's talk about mental health. The connection between mental health and overall healthcare costs is undeniable. Employees who struggle with stress, anxiety, or depression are more likely to experience physical health problems, which in turn leads to higher healthcare costs. That's why it's so important for employers to prioritize mental health as part of their cost reduction strategies. Employee assistance programs, EAPs, are a great starting point, offering confidential counseling services that can help employees cope with personal and work-related challenges. In addition, organizing stress management workshops or mindfulness training can equip employees with the tools they need to manage stress before it leads to more serious health issues. Another effective strategy is to train managers on mental health first aid. This training helps managers recognize the signs of mental health issues in their team members and provides them with the skills to offer support or refer employees to professional help. Finally, consider offering flexible work schedules or remote work options. These can go a long way in helping employees achieve a better work-life balance, which can be crucial for maintaining mental health. By addressing mental health proactively, employers can not only address healthcare costs, but also create a more positive and more productive work environment. So there you have it, 7 innovative strategies that are helping employers across the country reduce healthcare costs, while still providing high-quality care for their employees. Reducing healthcare costs doesn't have to mean cutting corners. Employers have the power to implement innovative, cost-saving strategies that still prioritize the employee's health and well-being. So from wellness programs and mental health support to telemedicine and alternative funding models or direct contracting, there are numerous ways to manage rising healthcare expenses without sacrificing the quality of care provided to your employees. Remember, each company is different and there's no one-size-fits-all approach.